I'm Usha Chakravarthy. I'm a retina specialist. I've been working in the field of retina for well over 30 years. I was asked to give the Bowman Lecture, which is a great honor indeed. And the reason I titled my talk on the ruminations on age-related macular degeneration, a journey of distractions, because I have been very distracted by what I've learned and read about in AMD, in the literature, and my work too. Just for example, we've had different terminologies used to describe AMD. We also have had views which have been proven wrong over time. Initially we said that genetics had nothing to do with AMD because it was an age-related disorder, and then we found out in the mid-2000s that there was a very strong genetic link which has not been replicated in any other age-related disease in the body. We've also had to contend with worries about the development of atrophy in the eye when anti-VEGF agents, which is the keystone for managing wet AMD and many other exudative disorders of the retina, because VEGF is an important protein in the eye and anti-VEGF neutralizes it, and if VEGF plays an important role in the physiology, then the repercussions may be there. So in my talk today, I hope I manage to convince the audience that AMD is a single disorder, starts off with aging changes in the eye that is driven by vascular insufficiency and the normal aging process, and that geographic atrophy and choroidal neovascularization, which are the two sight-threatening manifestations, are really just two late-stage manifestations of AMD, and that they're not distinct, separate disorders. So the evidence that I covered went over ground where I hope I was able to show that all the risk factors that have been looked at in the past are associated in the same sort of way with both geographic atrophy and neovascular AMD, and that the pathways between the two only diverge insofar as the early manifestation is geographic atrophy or microscopic levels of atrophy, which then trigger the onset of neovascularization. So my ruminations on AMD took into account the evidence from a variety of different people and some of my own experiments.